So in the same way that we talked about how breast cancer is diagnosed and treated, prostate cancer has a pretty pro forma way of being looked at in this country. The current standard is for a man to after the age of 40, to have an annual digital rectal examination, meaning the doctor puts a finger into the rectum, feels the prostate gland, feels for enlargement and or the presence of any nodules or any asymmetry. In addition to that, a blood test is done called a PSA, which stands for prostate-specific antigen. And PSA most commonly is elevated in the presence of prostate cancer, but it can also be elevated in the presence of a benign enlargement of the prostate so that it's not specific. But if a PSA test shows up positive, even if the digital exam is normal, if the PSA is high, it's pretty sure that the guy's going to wind up with a biopsy, and they do a transrectal needle biopsy. And then they get the cells out and they look at them and they have what's called a Gleason score, Gleeson, with Gleasons down in like the 4-5 range being considered to be indolent, meaning there is cancer present but it doesn't look aggressive. And when the scores get up to 7, 8, or 9, then it's considered to be an aggressive cancer and more aggressive therapy is called for. So once that happens, the treatment options are radical prostatectomy, which is an operation that's done through an incision in the abdomen, where the prostate gland is isolated, identified, and removed in toto. And they also try to sample a little bit of the tissue around the prostate gland to see if there are any lymph nodes involved. Another treatment mode is to use a series of roughly 40 radiation treatments directed to the prostate gland to completely kill the gland and some of the surrounding tissues. And the other treatment mode that's most commonly available is called radiation seed implant therapy, where they take little granules or seeds of radioactive material and implant them directly into the prostate gland through a needle and leave them in there, and then they give out their radiation over a defined period of time, and that radiation kills the prostate, all the prostate cells. They're not trying to kill just the cancer, they're just going for the whole thing. One other somewhat newer treatment is using high-intensity focused ultrasound to kill the prostate cancer and the gland, which is just starting to be accepted in this country as a mainstream treatment. For years, several of the urologists from this country who knew about it would actually take their patients to either Mexico or the Dominican Republic, where they would have a clinic set up where they could provide that treatment outside of the FDA's purview and regulation. But I'm just hearing now that one of the urologists that I know of is now able to do it here. So that's changed. It's a less toxic form of treatment, and from the data that's available, it looks like it's every bit as effective as any of the other kinds. The last analysis that I looked at, which is probably 2 years ago, looking at the effectiveness of the various types of prostate cancer treatment, it did look like there was a slight survival advantage, meaning long-term survival after diagnosis, with the radical prostatectomy operation. But that's also the one that's fraught with the most in terms of complications, the complications being impotence and urinary dysfunction, including incontinence. So it's a big price to pay, potentially, to get rid of it. But there are also robotic surgeries that are done now, very, very precise, where they're able to do nerve-sparing prostatectomies so that there's a lower incidence of those complications that I've mentioned. And those need to be done by a true expert in the field. And actually, UCSF has one of the best treatment programs around for that, if someone were going to get a surgery for that. So that's treatment of the early stage prostate cancer. Once the horse is out of the barn, it's a different story. Once it's spread into the local lymph nodes or metastasized to the bones, which is a favorite place for it to go, then you're looking at systemic hormonal therapy in the same way we were looking at breast cancer. And here, what's been found is that using drugs that block the effect of testosterone will dramatically slow the growth of the prostate cancer. And those drugs are Lupron, which works on the pituitary gland, and Casodex, which works on the adrenal gland. So by turning off the pituitary's stimulation of the testicles, it shuts down the production of testosterone from the testicles. And by turning off the adrenal gland's production of testosterone, remember adrenals, DHEA, testosterone in women, by shutting that down, it effectively shuts down pretty much all the testosterone production in the body. That's been the standard treatment for a number of years. And Lupron is a hard drug to take, if any of you have ever taken it. It causes really significant fatigue. It causes really significant cognitive dysfunction. Casodex isn't quite as difficult, and then also there are chemotherapies that are used, and now there are immunotherapies that are starting to be used, as well as some molecular targeting agents for the metastatic forms of prostate cancer that have gotten very aggressive and spread to other parts of the body. And in spite of that, there are some types of very aggressive prostate cancer that just don't respond well necessarily to anything, and they can be quite painful. But what I've seen over the years is that the treatment of prostate cancer has really come of age in allowing men to live longer with fewer negative symptoms, some of the pain and dysfunction that it causes. So, besides the lifestyle intervention, which I also believe is very important, although I disagree with the diet part of Dean Ornish's
In other words,
program.
You're paleo-oriented?
Well, I've been paleo-oriented for a long time, and I'm really shifting towards keto at this point, ketogenic diet, and we'll go there in a little bit. So for prostate cancer, there's a few things that have turned up over the years that are actually pretty remarkable from the natural field. One of them is the antioxidant lycopene, which is what gives tomatoes its red color. Lycopene is an antioxidant substance that absolutely downregulates the growth of abnormal cells in the prostate cancer cells. There was a landmark study that was done, probably 9 or 10 years ago, where they took men with diagnosed prostate cancer who were all heading for radical prostatectomy surgery, and they put half of them on 20 milligrams of lycopene a day, and the others just did whatever they did. And then they restaged them at the time of surgery and found that the guys who'd been taking lycopene across the board, their prostate glands were much smaller and there was much less cancer involved. It didn't eliminate the cancer, but it clearly had an effect. The other substance that I think most of you probably know about is pomegranate extract. Pomegranate has also a down-regulating effect on prostate cancer cells, and because of that, is being used by many men as a preventative. It's super easy to take lycopene as a supplement. Super easy to drink a glass of pomegranate juice or take a pomegranate pill or two a day to get the effect of those substances as well.